Do you sometimes feel a burning pain when you pee? Or maybe you've noticed unusual discharge from your private parts. That might not just be a minor infection, it could be gonorrhea. Many people ignore these signs, thinking it's nothing serious. But left untreated, gonorrhea can lead to long-term problems like infertility. The good news, it's completely treatable if caught early. Have you or someone you know ever had a weird discharge or pain during urination? You're not alone. Millions face this each year, and understanding it is the first step to staying healthy. So what actually causes gonorrhea? It's caused by a tiny germ called Neisseria gonorrhoeae. Think of it like a microscopic burglar that sneaks into your body through sexual contact, whether it's vaginal, anal, or oral. It doesn't matter if you're a man or a woman. If you've had unprotected sex with someone who has it, you can catch it. Imagine sharing a drink with a friend who has a cold, but this germ spreads through sexual fluids, not saliva. That's why using protection like condoms is so important. Did you know you can have this germ and not even know it? That's how sneaky it can be. Now, what should you watch out for? In men, signs often include a yellow, green, or white drip from the penis and a burning feeling when peeing, like salt on a cut. For women, it's trickier because many don't feel anything at first. But some might notice unusual vaginal discharge, pelvic pain, or bleeding between periods. And yes, anyone who has anal or oral sex can get it in those areas too, causing pain, itching, or discharge from the rectum, or a sore throat with no cold. Ever felt like something's off, but can't explain why? These could be clues. Ignoring them might lead to bigger issues like blocked tubes in the reproductive system, which can make having babies harder later on. How do doctors find out if it's gonorrhea? They don't just guess, they test. You might pee into a cup or get a swab, a tiny cotton stick, from your penis, vagina, throat, or rectum. It sounds awkward, but it's quick and helps get the right treatment. Once confirmed, a shot of antibiotics, usually one in the arm, can clear it up. But here's the catch. Some strains are becoming resistant, meaning old medicines don't work as well. That's why it's crucial to take all the medicine, even if you feel better fast. Treated, great. But also tell your recent partners so they can get checked too. It's not about blame, it's about care. Can you avoid gonorrhea? Absolutely. Using condoms every time you have sex is like wearing a seatbelt. It doesn't guarantee 100%, but it greatly reduces risk. Being in a faithful relationship with a partner who's been tested is another smart move. And get tested regularly if you're sexually active with new or multiple partners. Think of it like a yearly checkup for your car. Your body deserves the same care. Would you drive with broken brakes? Probably not. So don't ignore your sexual health either. Remember, the quieter infections like gonorrhea can do silent damage. The fight against gonorrhea isn't standing still. Scientists are worried because this germ is becoming superbug strong, resisting more antibiotics. But newer research is exploring combo treatments, like 2 antibiotics together, to beat the tough strains. Labs are also working on faster tests that give results in minutes, not days. And guess what? A vaccine might be on the horizon. Yes, like how we have shots for HPV, researchers are testing ways to vaccinate against gonorrhea too. Exciting, totally. Until then, knowledge, protection, and testing are your best